This is April Crompton coming to you from Professor Beam's Data 620 class at UMGC. It's time to quit. If you haven't been compelled to quit smoking just yet, I hope this story will inspire you by clarifying why the risk is higher now than ever before. We all know that smoking causes cancer, especially lung cancer. This can result in death, and it can also cause people to live for many years with disability. This chart shows that smoking is correlated with death and disability from all cancers. These charts all show a p-value close to 0, proving the correlation. However, the strongest link can be seen in the higher age group, which shows with the R-squared metric that more than half of deaths from lung cancer can be accounted for by the prevalence of smoking. It makes sense that we would see the strength of this correlation later in life, because it can take decades for the effects of long-term smoking to manifest health consequences. A linear trend on smokers surveyed between 1995 and 2010 demonstrates this long-term effect against the actual recorded lung, tracheal, and bronchial cancer deaths and disabilities between 1990 and 2019. The decline in both smoking and lung cancer can be seen at the state level too. Reviewing several states shows the trend. Kentucky has one of the highest rates of both smoking and lung cancer, while Utah has the lowest. It's clear when looking at Utah's metrics that smoking isn't the only cause for lung cancer, but you can also see that the overall averages of death and smoking are less than half of Kentucky's numbers. And we can see the death rates improve over time, state by state. So this is good news. As a nation, we've certainly made progress, but now we've been hit with a pandemic. And drawing on what I learned from the medical doctors cited for their article, Injuries from Asymptomatic COVID-19 Disease, I'm concerned. COVID-19 is a respiratory infection that can leave people with ground glass opacities in their lungs. This condition is not new with COVID, nor is it limited to smokers, but it does mean unhealthy lungs, and around half of people who have COVID are also found to have GGOs. Not just severe cases either. Even mild and asymptomatic people can develop this signature of COVID-19. This trend line, accounting for an estimate of new risk, is just an idea. There is no information yet about whether people can fully recover. I sure hope they do. Typically, GGOs either stay the same size or grow, and that's when lung cancer risk increases. Smoking has been shown to increase the size of these opacities, and we already know that smoking causes lung cancer. I'm concerned that we'll find a new correlation with lung cancer over the coming decades, COVID-19 infection. Although smoking along with COVID-19 may further increase lung cancer risk, the only additional burden shown in this chart comes from the added proportion of non-smokers who likely contracted the disease. When asked to compare the damage that COVID-19 does versus smoking, Dr. Galatzados at Johns Hopkins said that mild COVID would be like I smoked for a decade. So I retroactively applied the proportion of people who got COVID according to the CDC to those who surveyed as non-smokers over the last 10 years, in order to show a new combined forecast of smokers along with non-smokers who had COVID. The forecast from this chart shows that we may have increasing lung cancer cases despite a continued reduction in smoking. To me, the proof is irrefutable that even young and healthy people can suffer long-term effects from COVID. So please don't give up yet. Protect yourself, your family, and our healthcare workers. Wear a mask, keep your distance, get vaccinated as soon as you can. And by all means necessary, if you smoke, quit now.